This is Liana with Wet Noses Pet Sitting, and we are a pet sitting and dog walking company in Northern Colorado. And today, as part of our Pet Care Tips series, I am here with Dr. Debbie Sunken with Country Companions Veterinary Service. Do you want to go ahead and tell us a little bit about yourself?
Sure. I am a Colorado State University graduate, and I own and operate my own house call veterinary practice. I mostly cover northern Larimer County, but I have a few clients in some other places like Johnstown and Berthoud and Windsor, so I do travel quite a bit.
Okay, so you're a mobile clinic, so you go out to people's homes and take care of pets in their homes.
Right.
Wonderful.
Exactly.
So awesome. So I'm so glad you're here. This is exciting. So as part of our series, we're asking everybody, what is the one thing that you believe all pet lovers should know?
And when you asked me that question, the first thing that sprang to mind is something that's important for owners to understand, but also, important for the health of your pet, and that's vaccines. Something that you may just kind of not think that there's a lot of information there that you need, but there actually is, because we do want to tailor it to each individual animal, and these are not cookie cutter pets. They all have different lifestyles, they all have different needs, and so that's kind of what I think every pet owner might need to know.
And so normally when you go into the veterinarian, you'll get a dog or a puppy or kitten, and you'll go to the veterinarian and there will be just a list, like here's your vaccines, these are the things you're getting.
Right.
So you're saying there's more flexibility there.
Absolutely there is, and there are certain ones that we consider core vaccines, and that actually has been kind of evaluated by the American Veterinary Medical Association, and I would guess that probably most veterinarians are going to follow those guidelines. So we're going to talk about which ones are, quote, core, and then we're going to talk about the ones that may be recommended in certain situations and maybe not recommended in some other situations.
That's fantastic.
Yeah.
Vaccines are super up in the media these days.
They are, and I know a lot of people can have some anxiety about them because you want to help your pet, you don't want to harm your pet, and so I'm hoping I can also alleviate some of those fears.
Okay, wonderful. So starting with core vaccines?
Actually what I wanted to start with first was maybe what you need to think about telling your veterinarian. I know some veterinarians who are not like me, who are not house call veterinarians, a lot of times they have pretty rigid appointment time slots, and so they've got to fit a lot into that time period. I have a little bit more flexibility time-wise, but it's important for you to kind of think about the things that might be helpful to your veterinarian when they're designing a protocol for your pet.
Okay, so the list of things that you should tell your vet when you go.
Right. So age, probably the receptionist is going to have that information when you make the appointment, but it's really important to not just think about when these guys are puppies. Yes, that's when the vaccines are probably more critical. They're at higher risk because their immune systems are naive. They're totally, functional. There's no problem with their immune system, but they just haven't been exposed to anything yet. So it is really, really important for those youngsters. But as they get older and they've been well vaccinated throughout their life, they're going to hit a point when they're geriatric when really we may not want to give those vaccines to every single elderly dog or cat. So that's important to know too. Like a lot of times when we see a cat, they may appear younger than they are, they may appear older than they are, so letting that vet know as best as you can, if it's a rescue, how old that animal is. So that's going to be important. The next big thing is lifestyle. Okay. If it's a cat, is it indoor only? Is it outdoor only or primarily? Is it indoor, outdoor pretty equally? And then for the outdoor ones, does he just stay in the backyard or does he like to roam the neighborhood and visit everybody? Those are going to be really important when we're determining for a cat which vaccines they need to get. For the dogs, there we're talking about, is this just an indoor backyard kind of dog, or is this a dog that gets on regular leash walks or maybe goes to doggy daycare? Or is going hiking and camping with the family, or maybe it's a hunting dog. So all those things are really important for the veterinarian to know when they're designing something for your specific pet. The other thing is you want to think about your household. Do you only have one pet and that's it? Or do you have multiple pets and maybe as some of them, pass away, you bring a new pet in?
Sure.
Or perhaps you have family members who, when they go out of town on vacation, they leave their pets with you. So you have more of a transient population, or maybe you're involved in foster care. And so you have animals coming in and out all the time.
Oh, that's a big one.
That's a big one too. So we got to know that stuff in order to make sure that we're providing the best health protection for that animal.
Okay.
Okay, so then we can kind of talk about types of vaccines.
Sounds good.
Just so we kind of get these classified so you'll know what I'm talking about when we actually talk about the specific ones. We basically can divide our vaccines into two groups. There are ones that are directed against viral organisms, and then there are ones that are directed against the bacterial organisms. That's important because most of the time our viral vaccines will provide a longer duration of immunity than our bacterial ones.
Okay.
So generally speaking, bacterial vaccines are only going to last about a year. That's why you need to get them boosted every year. But our viral ones are pretty good, and they're most of the time going to protect that animal for 3 to 5 years. We don't want to miss out on anybody, so we tend to say every 3 years on those core vaccines.
So what are some examples of different ones?
So if you're talking about viral, rabies, of course, is the one everybody knows. That's a viral and has really good long immunity. For the cats, we're talking about the feline viral rhinotracheitis, calici, and panleukopenia. So a lot of times veterinarians, because we don't want to say that mouthful, will either abbreviate it as FVRCP, or a lot of vets really want to kind of give you just the down and dirty, and they'll call it a distemper shot, because a lot of people already know the distemper shot from dogs. But let me tell you, this is not distemper. There's no distemper in there anywhere.
Okay.
So let's just kind of clarify that right away. For the dogs, there is what we call either the distemper virus, or sometimes we call it DA2PP, or sometimes we call it DHPP, because we really like to confuse you. No, that's not why. So that one is actually a combination vaccine, and they're all, for the most part, pretty bad viral organisms that we want to protect the dog against. So distemper is certainly one of those. Parvo, another one that people are really, really familiar with. And then parainfluenza, it's a respiratory virus. It generally is not going to kill the animal, but it can certainly make them feel pretty awful. So we would like to prevent that. And it's highly contagious, so we also want to prevent it for that reason. And then the final one is something called adenovirus type 2. Now, there really is no disease caused by adenovirus type 2, but canine hepatitis is adenovirus type 1, and lucky for us, adenovirus type 2 cross-protects for adenovirus type 1.
Okay.
But a lot of times, vets don't want to kind of go through that whole long explanation, and so what they'll say is, this is the hepatitis vaccine. So they'll say it's distemper, hepatitis, parvo, parainfluenza. So they both mean the same thing. We're protecting against hepatitis, we're just using a non-pathogenic side virus that is related to it.
Okay, that makes sense. Gotcha.
So those are kind of your core ones. I think the only other thing I wanted to mention about vaccines is recombinant vaccines. You may have heard of these. They're kind of newer. And what they are is we're protecting against a viral organism, but the way that we're delivering it to the immune system is by inserting part of that DNA in a non-pathogenic bacteria. So a bacteria that is totally benign, won't cause any trouble. So we just kind of insert the DNA of the virus in there because that's really what we want the immune system to respond to. But as you may have already guessed, the immune system is going to see this as a bacteria, not as a virus. They will protect against that virus, but the immunity is probably only going to be for about a year.
Okay.
So recombinant vaccines tend to be a lot more important in the cat world because in cats, repeated injections of any kind, and of course vaccines are the most common, can potentially cause a type of cancer called a fibrosarcoma. So we want to minimize the occurrence of that. And so sometimes we will use these recombinant vaccines because they seem to cause less inflammation, which we think is part of that scenario.
Okay, that makes sense.
So then I think we'll just go ahead and jump into the specific
Sure, that sounds great. Let's do it.
All right, so we're going to start with the cats. We've already talked a little bit about the FVRCP. The main thing I want to say, other than that it's a core vaccine, is you may ask yourself, well, why is it a core vaccine when my kitty is only indoors and never goes outdoors? And here's the reason. It's something we call a fomite. And basically what that means is that, let's say you're out at a friend's house or you're out walking around and a sweet little kitty comes up and rubs its face up against your leg and asks you to pet it. And of course, you're gonna pet it, you know. Well, if that cat, in fact, is carrying either the rhinovirus or the calicivirus or panleukopenia, those little viral particles are gonna stick to your clothing or to your hands, although hopefully we would wash afterwards, but they can stick to you, and then you go home, and then what is your cat gonna do? It's gonna come up and rub against you, and it's gonna pick up those viral particles.
And that's good, because we hear that with clients a lot, that they don't want to do vaccinations. My cat never goes anywhere.
And so, again, we're going to be only boostering these vaccines after the kitten protocol every 3 years. So we're not doing it a lot, but we want to just keep reminding that immune system, hey, this is what those viruses look like. So just, you know, keep remembering how to make antibodies against it.
Okay.
So then the next one I'm going to talk about is the feline leukemia virus, and that one is really not needed for every single cat.
Okay.
Leukemia virus doesn't live long in the environment. I think when I was in vet school, they said about 2 hours. In Colorado, where it's super dry, it may not, and cold, it may not last even that long. So really the cats who need this vaccine are the ones that not only go outdoors, but are likely to come in nose to nose or nose to behind contact, so very close contact with another cat who could potentially be carrying that virus. So, and the highest risk is to kittens and young cats under the age of 2.
Okay.
So if you think your cat falls into that category, by all means, that's a vaccine that they should get. But if they're an indoor-only cat, very unlikely that they're going to need it unless they're a long-haired cat that goes to a groomer frequently, or possibly you foster other cats, or you bring a lot of cats in and out of your house. Then you might want to protect them against that one.
Okay. That makes sense.
The next one would be the feline immunodeficiency virus, which everybody kind of knows because a lot of the work for AIDS was actually done with this particular virus. We do have a vaccine against this. Most of the time, this particular disease has to be transmitted by a bite.
Okay.
So it doesn't just kind of hang out in the air or in the environment for the animal to pick up. So your cats that like to roam the neighborhood and get into fights, they're the ones that this vaccine was designed for. But here's the wrinkle with this one. Once you vaccinate your cat against FIV, they will now be positive anytime anyone does a test on them for FIV. We cannot distinguish between it being a vaccinated cat versus a cat that actually has the disease. And so if there's ever any chance that that cat will go to another home, we don't want them getting the vaccine.
Sure.
It's just too hard, and there's just sad, sad cases of animals that were euthanized because they thought they had FIV, when in fact they were just vaccinated. So that is not one that we generally would recommend. So situations where you would, let's say you're a kind person who has an FIV positive cat, wants to bring another cat into the household, you have no intention of ever having that cat go anywhere else but your home, yeah, maybe you would want to vaccinate them.
Okay, that's reasonable.
And catteries occasionally will use this one as well. But again, it's very low use, yeah.
Okay.
And then the final one for the cats would be FIP, feline infectious peritonitis. Sorry, I have to remember all my acronyms.
It's a lot of big words.
It's a lot of them, Yeah. So this one is, it's the nightmare for the veterinarian. This one has 100% mortality if the animal gets FIP. Okay. Which is very disheartening, very sad. So there is a vaccine. Here's the downside to the vaccine, though. It is derived from basically the benign version, or the one that causes just kind of mild illness. It's a type of virus called a coronavirus. For reasons we don't understand, sometimes out in the world, this coronavirus will mutate and turn into a very, very nasty virus that kills kitties. The problem with the vaccine is we're not 100% sure it cross-protects against that more virulent strain. And the other problem is that we see that there's a lot of kittens that maybe are exposed prior to their first visit to a vet, so prior to 8 weeks. And they may not manifest the disease until they're more like 2 to 4 months old. Okay. So unfortunately, that makes us question whether this vaccine is truly effective in preventing that disease. And right now, there isn't real good evidence that it is. So again, that's not one that I generally would recommend. Catteries, if they've had some situations crop up where this has been found in any of their kittens, yeah, they might use that. Okay, that makes good sense. Yeah. All right, so now we're going to shift to the dog vaccines. We've, again, already talked a little bit about the distemper one, the DA2PP. And that one, mainly what I want to say about that one is that you'll see with a lot of breeders that they'll give this shot when the puppy is 6 months old. Not really a great idea, because probably maternal antibody will interfere with that vaccine, and it's going to do no good for the puppy. So that's why we generally say the first puppy vaccine should be at 8 weeks, the next one at 12 weeks, and the final one at 16 weeks. Because at some point in that continuum is when that maternal antibody will go away and leave that puppy unprotected. So that's when we want our vaccine to be able to kick into gear. So and really, you only need a vaccine once, but in order to know that, you would need to test their blood work continuously to see where those maternal antibodies went away. And really going to do that. Yeah. And you're not going to come in every day for that test to find that key moment when that happens. So these are the kind of the protocols we've come up. Most puppies from healthy moms, it's probably going to be the 12-week shot is the one that kicks in. And then the insurance one is the 16-week one. And that actually does confer a little additional immunity to them, so it's never a bad idea. Okay. The 8-week one, little iffy. And like I said, generally the 6-week one, unless they were taken away from mom before they were weaned, or the mom was ill for some reason and you're not sure that the puppy got the full antibodies from her that they needed, then you might want to do an earlier one. And that happens a lot with rescue dogs and things like that. You want to do all of these just to be safe. Right. And the other thing that I would note too is that for brown and black dogs like Rottweilers and Dobermans, what we've been finding is that they seem to be more susceptible to the parvovirus. So there are some protocols out there that will recommend they get a 6-week parvo shot and then another one at 8 weeks, and then the 12 and the 16. And that's really just because, you know, like I said, those guys are a little bit more susceptible. And so if you have one of those breeds, you may want to consider doing that additional one. Interesting. I did not know that. That's great. So the next one we're going to talk about is kennel cough, or Bordetella bronchoseptica. And that vaccine, probably a lot of you know, this is by far the thing that I talk to clients about the most, because every boarding facility, every daycare, every groomer, every trainer are going to require your dog to have this vaccine. But here's the thing to remember about kennel cough, is just because they get the Bordetella vaccine doesn't mean they won't get kennel cough. Sure. And the reason for that is Bordetella isn't the only thing that causes kennel cough. There's a bunch of other bacteria, and there's even some viruses that would cause exactly the same tracheobronchitis and make them have that horrible whooping cough. So most of those facilities are doing it because they don't want an outbreak. But the problem really is that regardless of what the organism is that's causing the kennel cough, a lot of times it'll have an incubation period of about a week. And so during that time, the dog who has it is actually spreading it, is contagious, but is not showing any symptoms.
So by the time the dog is coughing, damage is done.
Damage is done. Damage is done. So the good news here, though, is that most dogs, the large percentage of dogs, are not going to get significantly ill with this. They're going to have the horrible cough, and it's going to drag on for a long period of time.
Sure.
But most of the time they're eating, they're playing, they're happy, they just have the cough. Now, the ones that we do want to treat with antibiotics, though, are the ones that maybe have some discharge from the eyes or the nose, are maybe dragging around and lethargic, or are not eating very well.
Okay.
Those guys, yeah, they're going to get some antibiotics.
That makes sense. Okay.
Yeah. Now, of course, it could still be viral, in which case the antibiotics will do no good, but still, we're going to try and protect them if that's the situation.
That sounds good. That makes sense.
Yeah. So the next one would be leptospirosis. That one has gained a lot more media attention in recent years. That one is also a bacteria, which is also why you have to get that every year if your dog is getting it. Here are the dogs that really need to get it, though. Ones that are going to come in contact with water sources, and this is moving water, not standing water. So streams and creeks and irrigation ditches and that kind of thing, because this particular bacteria can live for long periods of time in the soil at the bottom of these waterways. And only when they get churned up due to flooding or spring runoff, then it's going to come out of its little capsule and it's going to be free flowing in the water. So a dog that goes into that water or drinks from that water source can pick it up. They can also get it because, of course, wildlife are going to drink out of that water too.
Yes.
And this particular bacteria is shed in the urine, which is sort of unusual. Most of our bacteria are shed in the feces, but this one is shed in the urine. And so, let's say you live somewhere in the foothills or you're near a big field and you have maybe a lot of raccoons that can find their way into your yard and pee in your sandbox. And if that happens and your dog goes out fairly soon afterwards, I mean, if there's a long period of time in between, probably this won't be very infective. But if they go out fairly soon afterward and they're sniffing where that raccoon was, they can pick up leptospirosis that way as well. So it does cause significant illness, especially if we don't catch it early. So it is a concern, and certainly if you have a hunting dog or a dog that goes hiking and camping with you and does go in and out of water a lot, that probably is the key dog that we want to protect.
Okay.
Ones that are mostly homebodies and don't really go outside much, they probably don't need this vaccine.
Okay.
Yeah.
That makes sense.
Yep. Another one I'm just going to touch real briefly on is Giardia. Giardia is a vaccine actually against a protozoa. So now I'm throwing another name at you. These are just little one-cell organisms. And what we know about that is that Giardia, you can probably find it in a lot of stool samples from a lot of dogs where it's causing no trouble whatsoever. But for some dogs, it will cause a single outbreak of some very nasty diarrhea. We treat it with an antibiotic that seems to help the immune system tamp down on that organism. It does not kill it. It just manages to impede it so that the body can get rid of it. Or we use a dewormer, which is also somewhat effective against it. But again, it's probably not going to kill it. It's just going to impede it. The only dogs that should get this vaccine, though, because again, it is not going to prevent them from getting Giardia. It is just going to minimize the outbreak and hopefully shorten the duration of time they have the diarrhea. So with this one, the only dogs really that I feel should get it are ones who chronically have diarrhea and maybe are harboring this organism, or the ones that just like, dang, every time you take them up to camp, next week they've got diarrhea. So those chronic guys or those frequent flyers, those are the ones you want to give that vaccine to.
And I do know those dogs.
They're out there.
Yes.
Yeah. And then the final dog one I just want to touch on, because I get questions on this every summer, is the rattlesnake vaccine. I'm sure a lot of people have heard about this one. For a long time, there's only one company, Red Rock Biologics, that had a rattlesnake vaccine. They now have a little bit of competition from another manufacturer. So there's basically two brands out there. Unfortunately, they're fairly similar. They basically are using a vaccine to expose the immune system to a little bit of rattlesnake venom. And then the hope is that the dog will mount an antibody response, because we do know that dogs are able to create antibodies against rattlesnake venom. And so what we're hoping with that vaccine is that those antibodies will already be there when they get bit, or if they get bit, and that will help protect them. Here's the downside to this one, though. The venom is derived from the western diamondback. That is not the rattlesnake we have here.
Yes.
So what we do know is that cross protection against other species of rattlesnake is either limited or just not there at all. So, you may think you're protecting your dog, but you may not be.
So for people who live in areas that do have diamondbacks, they can at least look at it.
They can look at it. Here's the other part that you have to remember, and I don't know how well the company puts this information out there, but because this antibodies production is short-lived, you basically during rattlesnake season have to revaccinate them every 6 weeks. And this is a very expensive vaccine. And we do know that there are some dogs that will get a pretty significant skin or soft tissue reaction to that vaccine, especially after receiving it multiple times. And then, of course, they can't ever get it again.
Great. So that's not one that sounds ideal in almost any situation.
And even the company will tell you with that one, it does not negate the need for you to take your animal, if it gets bit, to an emergency hospital and get anti-venom.
So maybe that's one to wait on for a while to see if
we might want to see if they can get that one improved a little bit and have a little bit better protection and maybe a little bit longer duration.
Sure. Because some people watching this video might be in areas that have diamondbacks.
Sure. And we're all hoping for something like that, that will buy us some time at least to get them to an emergency hospital. But for right now, I don't know that the evidence is really there yet on it.
That makes sense.
Yeah. And then the final one, rabies. We all know about rabies, right? So with this one, the main thing to remember is that there's a human health risk. It's what we call a zoonotic disease. And so that means that any mammal can actually get rabies. In certain parts of our country, there's a much higher risk than in other parts of the country. Here in Colorado, actually for years and years and years, the only wildlife reservoir we had were bats. Not too many of our dogs come in contact with bats. So we felt pretty comfortable that we didn't have to worry too much about rabies here. Unfortunately, starting in about 2005, there's been some changes to the skunk population as other skunks have moved into our area from further east. Those guys, unfortunately, do tend to keep having the rabies virus circulate in their population. So these days we're a lot more adamant about getting everybody vaccinated against rabies. And when your veterinarian does that, and it does, this one absolutely must be done by a veterinarian. The other ones potentially can be done by an owner who feels very competent with injections. But this one we have to have documentation for. And you will be provided with a certificate and usually a tag to go on the collar. But what I will tell you is the important part is the certificate, because you need to keep that somewhere safe that you can grab it at a moment's notice. Because should your dog ever get into a fight with another dog, or heaven forbid bite a human, you are going to have to produce that certificate to prove that they should not be euthanized and tested for rabies, that they can just be quarantined. The other time would be like, let's say you were running your dog off lead and an animal control officer stops you, he will ask you for documentation on your rabies. So you want to be able to provide that.
If you want an electronic trick after you get your certificate, put it somewhere safe, but first take a picture of it. And then upload it somewhere that you're not going to lose it.
Right. So. And don't stress about the tag. Tags get lost all the time. The real important thing is the paper.
Yes.
Or the digital.
Yeah. I like backups. I'm a big backup person. And I
Good idea.
Find paper after the fact.
That's a great tip.
Awesome.
And that's it.
That's great. So thanks so much for joining us. This was really great information.
Oh, good.
There was a lot in there.
I probably probably, I might have missed your favorite vaccine. I'm sorry if I did, but there are definitely other vaccines out there. But I think these are the ones you're most likely to encounter and the ones that your vet might recommend in certain situations.
Absolutely. Those are the ones that I'm hearing a lot about these days that people are asking questions about. So if people want to find out more about you, how can they reach you?
So basically, you can either reach me by phone. My phone number for Country Companions Veterinary Service is 970-881-2526. You can also reach me by email, and my email's basically the business name but abbreviated. So it's ccvetsvc@gmail.com.
And I will have all this information in the notes below.
That's
so
right.
Take a look.
If you're like, what? Where are all those letters? Liana can help you.
Yes, we got all that information there. So that's fantastic. You should take a look.
And especially if you have a dog that doesn't really enjoy their clinic experience, a lot of these dogs and cats are much happier at home. They still don't love what I have to do. I have to poke and I have to prod, but they're very happy that they can go right to their safe place after we're done. So
Absolutely.
house call is a nice niche for a lot of animals.
And it's growing. Like a lot more people are looking at it as an option instead of just, used to be, I would suggest it for people and they would just dismiss it offhand. And now people are really interested in the idea and curious about looking into it.
And certainly for elderly folks who maybe are a little bit more unlikely to have transportation or just find it hard to carry a carrier.
Or elderly pets who don't want to go in the carrier
that's
and
true
it's more
too.
stressful for them.
And a lot of those guys are going to be happier at home.
Absolutely. Well, wonderful. Thank you guys for watching. Definitely subscribe and follow us so that you can see videos every week with more pet care tips. And go ahead and take the information, look at the information below so that you have all of the details. Thanks so much for joining us.
Thanks.